Okay, sweet. How to tie this all together, okay? This is how I personally think about using peptides in conjunction to make something that is not just, okay, you're having a procedure, take this one peptide, okay? The way I'm thinking about it, and maybe Danny will invite me back one day to do a longer lecture that includes this first part, but before a procedure, I want to activate senescent cells, so we want senolytics, and I want to induce autophagy and mitophagy, basically to make the environment of the human healthier, so that way when we come in with a therapy, they're going to respond better, or they're likely to respond better. Then afterwards, I use therapies that are going to promote anabolism, growth, and differentiation, okay? So things in our autophagy and senolytics that I'm exploring, using, experimenting with, fasting, big fan of fasting, rapamycin and rapalogs, quercetin and dasatinib, our NAD, and then some of our peptides, thymosin alpha, MOTC, 5-amino 1NQ, and our FOXO4 peptide, okay? These kind of all stimulate the senescent cells to kind of not be senescent anymore. And then in terms of our growth and differentiation, I think I'm a huge fan of collagen. I think it works super, super well for patients. Most patients, especially women, need to up their protein intake after procedures because they're getting nowhere near what we want to maximize healing. So my bare minimum is 1 gram per kilo. So if a 60-kilo woman, I'm doing a procedure on her, I at least want her getting 60 grams. More ideally would actually be 2 grams per kilo. Okay, so that's going to be about 120 grams for her. We all know that Zach definitely gets more than 2 grams per kilo. Our NAD, again, is still beneficial at this time point, and then our peptides. The 3 that we talked about here today, I didn't include PPS because I'm still figuring out that one post-procedure, but then 2 other ones which I knew I wouldn't have time to get into today, which is GHK copper and the pegylated form of MGF. Sweet, here are my sources, and we got 7 minutes.